all the textbook stuff, but a lot of the stuff you can't learn in the textbooks. You can't learn in the traditional medical schools. Dr. Hal Blatman, he runs the Wellness Center in Cincinnati and here in New York, the Blatman Health and Wellness Center. Doctor, welcome. How are you?
Thank you very much, Greg. It's wonderful to be here.
And one of the big things that you told me, I'm aching all over the place at the time, diet. I never had any idea that diet really can have an impact on one's bodily pain.
I would say that food and inflammatory food in the average chronic pain patient is at least 50% of the pain you walk around with.
50%. And what are the basic, and it's not like this crazy diet we have to go on. There are just certain things we should do and avoid. What are they?
Gluten, dairy from cow, and sugar are the three big ones. And the things that turn into sugar can make you really uncomfortable, like white potatoes.
White potatoes, dairy from cow. We want to avoid that. Gluten. So, all right. What does that list look like what does that translate into food?
It translates to you avoid a lot of those grains. And what people don't understand is the absolute nature of where this goes, because the tiniest amount of gluten contamination can make your back hurt for 4 weeks.
Oh my goodness. Doctor, I think you have this all figured out. So Dr. Hal Blatman, my special guest, stay with us, folks. This could change your life. You went to medical school, and what kind of doctor were you planning to be?
I wasn't really sure, but I started in orthopedic surgery.
Orthopedic surgery, bone surgery.
Bones and joints, breaking bones, making them straight, replacing joints, repairing tendons, rotator cuff tendons, doing sports medicine at the highest level. That's where we were at the University of Cincinnati, and putting fingers back on when people got them cut off.
Wow. All right. All that's great work. We needed to be done, right? But you had would you call it an epiphany? Did you have I want to go in this direction? Was there a moment, or was there something that kind of put you on a new path?
It was orthopedic clinic, and people would come in and they'd have their pains and their joint pains. And back in those days, we were taught, don't prescribe Percocet, prescribe Motrin. And there was a 400 milligram Motrin. We prescribed that. People would come back to clinic and say it didn't work. Fortunately, there was a 600 milligram Motrin just came out, so we used that. And that didn't work any better. And I started to realize that pain is not what we were taught. And what we were taught isn't working to get people out of pain, so there's got to be another answer.
Percocet. Boy, that stuff is powerful stuff.
Yes, it is.
And and that stuff in a weird way works, but it gets people hooked, right?
It sure can.
Okay, so pain was not being managed. So how did you figure out this kind of new way to manage it?
Well, I hurt my back on the Nautilus low back machine back in the early 1980s. And I got this journal article from a doctor telling us how we could do a physical exam to prove that the patient was faking. Because in those days, you couldn't tell whether somebody was faking and just trying to get their Percocet or not. So you had to determine that. And I realized I'm 4 days out of my injury. I didn't have my first pain-free moment yet, and I couldn't pass this guy's test. And I realized that the person who wrote this article didn't know the first thing about pain. He never had pain in his life. And whatever he wrote in his article was totally irrelevant and didn't work.
But that was like almost industry standard.
Correct.
Wow. All right. You had genuine pain, and you wouldn't qualify to get the pain relief. Incredible. So, all right.
And then through the years, I started to learn about food, and the more I changed my food, the better my pain got. And I got to tell you, I played golf with lower back pain in every swing for 25 years. So I figured how to make it go away. And to do that, I had to unkink the fascia strings that got tied up from the injuries of a lifetime, and I had to repair the injuries to the tendons that hold my gluteal muscles together. And as I got that done and fixed my food, I was able to make almost all my back pain go away. And then I found out it's universal. It's all of us. It's rarely the disc, rarely the nerve. It's injuries of a lifetime that cause this pain.
You happen to be very slim, by the way, and you wake up in the morning and you're pain-free?
Not pain-free, but by the time I've done my morning routine and exercises, I'm pretty pain-free. And compared to the pain I used to have, I play golf with no pain on any swing.
What do you mean about lifetime injuries?
Well, if you can touch a muscle in your neck, in the front of your neck, and you can feel it's tender. You can push on the space above your collarbone, and you can feel that's tender. Collarbone tenderness is the injury that causes the tenderness in the muscle in the front of your neck. And the first time you got that injury, you were an infant, and somebody picked you up by your shoulders and forgot to bring your head. And another time you had that injury, you were in the playground, and some little kid came up behind you, shoved you forward, snapped your head back, and made that injury that now is leading to headaches and a pain we call trigeminal neuralgia, or possibly the rest of your life. Because nobody's figured out that your headache doesn't come from your head, your blood vessels, or your nerves. Your headache comes from the fascia injuries of a lifetime to your neck and shoulders and upper back.
Man, so that's a revolutionary way to look at it. And we can't avoid that childhood stuff, right? It's just going to happen.
And we jumped out of trees, and we jumped out of swing sets, and 30% of us, my estimate at least, jumped off at least the first story of the roof. And when we land, we tear those tissues, and as we get older, they become less resilient. And now we lift a bag of mulch. We feel something shift, and we got pain down our leg that we think is coming from the disc in our lower back.
So this is not for me, selfishly. I have a 2-year-old and a 4-year-old. Look, they should still go out and play and do that stuff, right?
Absolutely.
They're not going to be there. They should still jump and have fun.
Yes.
All right. But once they get older, this is the way to manage it. Doctor, when a patient comes in, how do you handle it? By the way, you got a great bedside manner. You know what I mean?
Thank you.
The gentle, I feel like I could tell you anything. A patient comes in suffering from, who do you want to see? Who should see you?
I want to see anybody who's really sick and tired of being sick and tired. And in our first visit for a chronic pain patient, our first goal is to help show you in your first visit the injuries through your lifetime that cause the pain, help you understand what your body needs to do to make that pain go away, and then get you started doing it so some of your pain is gone before you walk out of the office on the first day, and you know this is going to work.
I don't know you press a couple of buttons. It feels like you're pressing buttons, right? And you're in there, and it does kind of work itself out. What kind of follow-up? How does it work? What is the Dr. Blatman experience like after the initial checkout?
We send you home learning how to change your food. We send you home learning how to do your own body work so that you can make your own pain go away, whether it's in your knee or your neck or your shoulders or even your lower back. And then as you come in, we do body work to help unkink the injuries of a lifetime and then restore your tendons and make them whole again so that when you pull, you anchor and you hold together instead of tearing yourself apart from the inside.
All right. I think this is incredible. 844-282-8900, 844-282-8900. If you want to see Dr. Blatman, and he's very accessible. You're right in Midtown. What's your address?
120 East 56 on the 12th floor between Park and Lexington.
That's where I go to see my dentist, actually. That's a very convenient location right off of Park Avenue. By the way, you see people in New York, and you also have a thriving practice in, of all places, Cincinnati.
Cincinnati, Ohio, that's correct.
You're back and forth. Cincinnati. Are the New York patients different from the Cincinnati patients?
Totally different culture and a lot of fun.
I was hoping you were, I don't know what I was going to, I thought you would say, people are people. How are we different?
People are people. The injuries are the same. The pain is the same, but the culture is very different.
Are we more vocal about our pain here?
You want to get it done.
Yeah.
You don't have time to waste. You don't have time to be in pain. You want to get it gone and go back to work and back to your life. And you don't have time for this.
I think that's code for it. We're a little pushy. That's okay. No, we're not pushy. We're just, time is money here in New York. Well, all right. Let's see here. We want to go to the Blatman healthandwellness.com. So that's BlatmanHealthandWellness.com. And you can also call that number 844-282-8900. You go in, you kind of people learn exponentially what about their body. That stuff about childhood, that's incredible. And then the diet thing is really, it's not that hard either. I mean, it's not that hard to avoid yogurt. Let's face it, right?
Correct.
And if you,
that hard. And when you realize that a little bit's going to make your neck and shoulders hurt for 4 weeks, that's a big deal.
Uh-huh.
And then there's people who come in with joints, and they want their joints to get better because their knees hurt. And you read all over that you can't regrow cartilage in a worn-out joint, and that is so not true.
You can't regrow cartilage in a worn-out joint.
Even the orthopedic textbooks say that when you're born with cartilage and you wear it out with time and then you go get your joint replaced, that's utter nonsense.
Overall, they talk about the healthcare industry, and sometimes I've heard that they kind of want people sick. They want people reliant on them. I'm not talking doctors, maybe it's big pharma. I don't know. We don't have a wellness system. We have a sickness system. Do you have any thoughts on that?
All that's true. We all hear those words all the time. And what we focus on is how do you restore this biology to health?
How do you restore this biology to health? Well, see you, and you'll learn a lot. 844-282-8900, and it's Blatman, Blatman, healthandwellness.com. Can I just ask you this? You chose to be a doctor. A lot of things people can choose to do. Why did you choose that?
I really wanted to help people. I wanted to be able to use my imagination. I wanted to make sure that through my lifetime, I would be figuring things out and I would never be bored.
Doctors are never bored?
I'm fascinated by what I do every day. I learn something new every day, and I'm able to apply it to help people every day. And I watch people get out of pain, and I watch people get out of misery. And that is so rewarding. I couldn't be in a better place.
Wow. Well, doctor, I'm sold. And folks, he's the real deal. And Blatman Health and Wellness, Blatman. What kind of name is that, by the way? Is it what were your ancestors?
I think they partly Poland, partly Ukraine. Is the best we can figure.
And but now American. Bottom line,
third generation.
Third generation. First doctor in the family.
Actually, I'm second generation. Yeah, first doctor in the family.
Well, congratulations, and thank you for what you're doing. And folks, go check it out. It's really interesting, and a pain-free life is available. No pills, and a couple of modest changes. And 844-282-8900, Blatman Health and Wellness. Doctor, thank you very much. Great to talk to you.
Thank you, Greg. Wonderful to see you again.
And to be continued, we'll be right back.